to present her paper now, and it will be very interesting. She will be briefing about homeopathy in Canada and later on the current COVID situation. Now, over to you, Harpreet.
All right. Hello, everybody. Good morning, everyone. Actually, it's evening for most of you. It's indeed bright Sunday morning here. Before I even begin, thanks to Alumni Association for inviting me to speak today. And a very warm regards to Dr. Kalyani sir, Dr. Shashikant Tiwari sir, and Dr. Bidut sir. It's indeed a prayer. I always wanted, every time I go to India, I always think that I am going to visit an IH one day, but it just my plan just crashes every time. But I'm very glad that I was invited today, and I can actually join this team platform. So I'll start my presentation. Before even I begin with, I'll tell a brief about myself. My name is Harpreet Kaur Sahni, and I am 11th batch NIH alumni, and I have bachelor's, of course, BHMS, and bachelor's in psychology and diploma in nutrition and health education. I'm a holistic health coach as well. I moved to Canada almost 13 years back, and since then I have been practicing homeopathy here. I'm located in central Canada. I am a licensed physician and I have a clinic of my own. I was very fortunate enough to start my practice as soon as I came here. I am successfully treating varied ranges of patients here, acute as well as chronic. So today I'm invited to speak about homeopathy in Canada, and a little later we'll share my thoughts related to the ongoing pandemic as well. So let's begin. Before I begin, I'll just start to share my screen here. Just a second. All right. Yes. So to begin with, Canada does recognize homeopathy as a natural healing therapy and categorize it under the broad umbrella of naturopathy. In Canada, every occupation is given a code under a classification system called NOC, National Occupational Classification. It is designed to classify occupational information from statistical surveys. And under that, homeopaths have been given NOC code 3232. That is practitioners of natural healing, and we are categorized here amongst other like acupuncturists and herbalists and reflexologists, etc. Here, it is important to note that Health Canada regulates healthcare products, but not the practice of medicine by healthcare practitioners. These responsibilities fall under the jurisdiction of Canada's provincial and territorial governments. Homeopathic medicines are regulated in Canada by Health Canada, the federal government department, and it's responsible for ensuring the safety, efficacy, and compositional integrity of healthcare products distributed and sold in Canada. Health Canada has formally recognized homeopathic medicines as a pharmaceutical product since 1990. The Natural Health Products Act came into force in 2004, and the definition of NHP contained in the NHP regulation defines all the natural health products as drug products as opposed to foods, and they include homeopathic medicines. We all know about DIN numbers, drug identification number. However, the product licensings granted to homeopathic medicines here in Canada by Health Canada have a unique product identifier. It is DIN HM, so drug identification number, homeopathic medicine, to enable consumers and healthcare practitioners to more easily identify homeopathic medicines in the Canadian market. The NHP Directorate facilitates the appropriate regulation of thousands of homeopathic medicines. It is important to note that labeling standards clearly define how homeopathic medicines may be labeled and what indications for use are specifically permitted, because they're very strict in labeling nosodes. For example, they have requested to include a statement of nosode labels. Every bottle of the nosodes that come, it has to have this these lines in, like, I can read it for you, that this product is neither a vaccine nor an alternative to vaccination. This product has not been proven to prevent infection. Health Canada does not recommend its use in children and advises that your child receive all routine vaccination, because vaccination is a big thing here, and you cannot say anything against vaccinations here. So that is why NOSOD's labeling comes into play, and NHP regulations are very strict in that. And Health Canada has almost approved 8,500 homeopathic medicines till date. Medicines are very readily available, ranging from mother tinctures, CM scale, decimal scale, 50 millisimal scale, and biochemic medicines, etc. There's a database on the Health Canada website that lists these approved products. So, but there are some substances that are not regulated. Here's a list that you can see on your screen. Yeah. So all these medicines, we can't keep it in our clinic. I miss my strontian carb most of the time with ankle sprains and everything, but that's how it is. These are not regulated substances, and we cannot keep this in the clinic. So this was about the homeopathic medicines. So as I mentioned, that regarding regulation of homeopathy, uh, the healthcare practitioners fall under the jurisdiction of Canada's provincial and territorial governments. So in all of the Canada except Ontario, homeopathy is a non-regulated occupation till now. A job in a non-regulated occupation is one for which you don't need a license, certificate, or registration to work. And most of the insurance companies don't cover you. A job at this time, Ontario is the only province that regulates homeopaths. College of Homeopaths of Ontario was established and to govern the homeopathy in Ontario. On April 2015, the Homeopathy Act 2007 was proclaimed, and then the Transitional Council of College of Homeopaths of Ontario officially became the new College of Homeopaths of Ontario. It was an essential effort to gain public confidence in the practice of homeopathy, and I must say, to end quackery that is very much rampant here. And the College of Homeopaths of Ontario is a statutory body mandated to regulate the homeopathic profession. And as like other colleges anywhere, the mission of this college is to protect the public interest through self-regulations of the practice of homeopathy by setting standards for competent and ethical practice. There are various associations across Canada besides Ontario offering memberships mainly to maintain and promote high standards of performance by all registered members, promote and encourage professional development, growth, and renewal. And it exemplifies the codes of professional conduct and protects the public welfare as well. And the most important, I think that all of this is enhancing the visibility of the profession. So and but now the part that I really don't like talking about is limitation, but we have a lot of limitations here as well, because under the Homeopathy Act 2007, the scope of practice is defined as the assessment of body system disorders and treatment using homeopathic techniques to promote, maintain, or restore health. But it does not give homeopaths the rights to other medical tests, investigations. So we mainly rely on the modern system medicines to run tests and investigations for the patients. And then we can subsequently ask the patients to show us the records. So, we are very restricted in that sense. We are not allowed to make any diagnosis. And the most important, we can't advise against the modern system medicines. You are taken to task very easily. So and the homeopaths avoid conducting a physical examination of the patient. And uh, and the most important, which I have always, this disheartened me quite a bit, was regarding the use of title doctor. um, uh, After this regulation act, we can't use the title of doctor. I mean, I can't use Dr. Harpreet Sahni. I can use doctor of homeopathy, I can use homeopathic physician, but unfortunately I can't. I can use that only in India when I'm traveling. So, and one more thing, to make the matters a little bit more tough, here the allopathic consultations are free of cost. So majority of the medicines are covered by insurance companies. So that this makes the matters more difficult. And but with homeopathy, when a person is coming to see a homeopath, he has to pay from their own pocket. So they have this thing that, going to an allopathic physician, they have everything free, everything is covered. But then they are coming to you when you're asking them to pay, then sometimes it becomes a deterrent. So when I started practicing here, most of the patients that I saw in my practice were very, very complex cases, awaiting surgeries or people wanting to see specialists, and already undergoing complex treatments. Here I would really like to mention one thing, that I could only see those patients with confidence because I graduated from NIH. I was very blessed to learn from great stalwarts in NIH. I don't say that I practice just one style of homeopathy. I have learned how to give one constitutional, one palliative, and one biochemic remedy from Dr. Dubesar's clinic. And I have learned how to give the so-called small and rare medicines from Dr. Sarkar's clinic. I've also learned how to diagnose and treat and palliate from attending hours and hours of Dr. Pralay sir's very, very extensive and busy OPD. Whereas I must mention that I've also learned how to prescribe sepia and natrimur and thuja with patience and conviction and great perseverance from Dr. Adhikari sir in ever increasing LM potencies. Uh, and and I have learned how to explore the mental sphere from Dr. LM Khan sir. And I keenly turn the pages of my LN remembering Dr. Azid Khan sir's trial. So, you know what? With great pride, I try to equip my armor with all this knowledge and tackle my patients here. Most of the many people here, or many colleagues who are here, might see a reflection of atypical homeopath, and I'm going to talk about some things here in me. But I just focus on the last verdict that the patient has to pass when they say homeopathy saved me. Trust me, my friends, that verdict in foreign land with restrictions make me a very, very proud NIH alumni. And I'm thankful to all my teachers, my seniors, my colleagues, and my juniors for all that support. All right. Now let's come to the burning topic of the COVID-19. All right. So, with this ongoing pandemic, these are my opinions in this, and I think we should consider arsenic album or genus epidemicus, for that matter, as a foot in the door. I will elaborate it a little bit. Most people across the world now know about the remedy arsenic album thanks to WhatsApp and social media, but we all know that all the COVID cases will not get better with that, or nor will get prevented by that. But at least we will have people inquiring about the particular homeopathic medicine, and we can use that opportunity to educate people about what homeopathy has to offer to them. We can educate people regarding the constitutional treatment, how homeopathic medicine work. You know what? It is very important for me here, rather than in India, because people are not aware about homeopathy. I had people calling me and asking me that, do you have arsenic album? Will this help me in the pandemic? So I had people here who are taking constitutional treatments from me, and I have continued with that, not giving them arsenic in between. Um, but to some people, yes, I have started with the genus Epidemicus. So, and my opinion here is that we have to equip ourselves with the vast array of symptoms related to COVID, directly or indirectly as well. COVID, it's just like that ancient mythological Leonid Hydra. COVID has many heads. We have to get well versed with all the heads that we might come across this pandemic related directly or indirectly. Um, I'm not going to focus on the main symptoms of COVID, as you people are seeing far, far, far more cases than I've seen till date. But I'm tackling indirectly linked patients to this pandemic all the time. I'll elaborate the indirect, what I mean by indirect. As as people are coming with the fear psychosis, OCD, loneliness, depression, suicidal tendencies, social aloofness, uh, asthmatic exacerbations, breathing troubles, and skin flare-ups, chemical poisonings. So we will definitely see all these related symptoms in future, or as this situation is going to linger for some time. The most important being fear psychosis revolving around the COVID, sense of insecurity. What if I get COVID? What if a small flu is COVID? Am I suffering from that? So as a homeopath, that those mental symptoms really give us the edge over other system, because we can deal with that state of mind where a patient is coming and saying that, oh, you know what, I'm scared, or if they have to go to allopathic doctors, they don't have anything to offer to them. But we have that upper edge. 99% of the patients who are not suffering from that are suffering from that fear psychosis right now. For me, as a mother of two kids who are going to resume school, I'm having those apprehension things that, what if, how will I send my kid? So I always describe it to my patients that homeopathy doesn't change your situation, but it has the capacity to change the perspective to your situation. So how you're going to react to it. So I was, just making some notes. I was trying to go through the pages of repertory, and I would like to share some rubrics with you guys. I'm sure they might sound familiar to you. Like, people will come because they're reading so many of things in the newspapers and whatnot. So I was going through the rubric that mind horrible things, sad stories affect. Uh, and we have fear, danger of impending. And then we have diseases of impending, anxieties. So we have this edge, and we have to equip ourselves. We have to start reading those things. Here, you know what? I'll mention one case here, which came to me in June. The patient had a little bit of flu, but really was anxious and thought that he has COVID. All he was thinking 24/7 was his health, and thought he won't get well, and was again and again saying that, I don't know what is happening to me. One important symptom I came across was that he used to come to me with so much of unrest. And when I would make him understand that, no, these are just these are the symptoms, you don't have the COVID symptoms, you'll be fine, because I accept, I saw that these symptoms are not related to COVID, but he was really, really anxious. So, you don't have those symptoms, you'll be fine. All of a sudden, he felt relieved. Here, we see that, when there's a build of the flutters is kind of unrest for the person, and once released, patient gets relieved. So I was seeing that, we have flutters amelioration in generalities, and then we have flutters amelioration in abdomen, and then we have flutters amelioration in mind. So, because of this buildup of this anxiety in mind, and when it was released, he felt relief immediately. It may be temporary, but he did feel better after that release. So I did some research, and I was looking into the interpretations of the rubrics and everything, and I took this rubric as well. and I did my case analysis and gave him calcarea carb, and few doses he was better. I had to give him calcarea carb 200 as well, and he responded to the treatment very well. All his anxiety, all his everything was gone. He was attending to his office every day now, and so he was fine. I did this repertorial analysis. You know what? I will share one experience here, and just to make some things lighter here, I fondly remember one incident that happened in the internship days in NIH OPD. I would share that. I was in final year at that time, and my cousin from Chicago, she sent me a very purple, beautiful Littmann stethoscope. I was really excited to get that. And that day we had this medicine OPD in Dr. S.C. Desar's class. What a fantastic teacher he was. And with great pride, I was wearing my purple stetho on white coat and standing there, beaming with happiness. And a patient came which had murmur, and sir wanted us to auscultate and tell us what was it. And he, being such a great observer, must have observed me and my new position. And he said to me, hey, Litman, ekhane esho. I came forward and he said, bol to, ki ache? And I started hearing with, of course, my new lit man, and could just hear the heartbeat. I was trying hard to understand the condition, and within 20 seconds, sir tapped at my shoulder and grinning from side to side, he said to me, Kire, tor litman bolche na? So, and everyone was laughing, and I was completely, red. But when I think about it, is the takeaway from this is that sometimes we start relying so much on our equipments that we differ from the real thing. So what here I'm trying to say is repertorization is one brilliant tool, but if we repertorize each and every case, it might distract us. This is my opinion. You can definitely disagree with me, but I do repertorize my cases most of the time, but sometimes, and in fact most of the time, you just know how to tackle your acutes. During this pandemic, I have been seeing patients with wide symptoms. I have been successfully treating them with medicines starting from bryonia, gilsemium, coccus cacti, calabi, senega, ammonium brome, entium tart, nux moscata, oxymum sanctum, pix liquida, piper nigrum, phosphorus. So these are just to name few. So as I was saying, that we are very much blessed that we are in that kind of community which can take care of these fear psychosis very well, as no other system can do it. So this is our edge over any other pathy right now. And so apart from that, there are problems arising from over sanitization, skin diseases related to over sanitizations. We should actually get very well versed with symptomatology of chemical inhalation toxicity. Hand sanitizers rampant use can lead to asthma flare-ups, skin ailments, and digestive tract abnormalities. Excessive washing of hands, eczema flare-up, and wearing latex gloves. I'm seeing these patients all day because so many patients are working as a cashier, they're working in the stores. So they're seeing this all the time. I had another day one lady, she her hands are turned into like a weeping eczema. She has to wear gloves, and then she has to wear some she's sanitizing so many times, 1,000 times in a day. So and we have medicines there, and we can definitely help. So again, we have a lot of edge over any other pathy right now. So inhaling large amount of isopropyl alcohol can cause nausea, vomiting, irritation of the nose and mucous membranes, throat irritation, whatnot, and even difficulty with breathing. And again, I had some rubrics that we can definitely look into it and prepare our medicines accordingly, because at least for me, I go through all these rubrics and see if there are some rare medicines, or if there are medicines that I need to pre-order, because I can't just get the medicines from the stores here. We have to place an order and take. So I was going through these rubrics, which might be of some interest to you guys as well. So generalities: gases, fumes, smokes, vapors aggravate sensitive, oversensitive odors to chemical cleaning chemicals. And then headache. I actually saw one patient with this headache. She, because of this so much of sanitizers, she was having a headache. This medicine, which is mentioned in Allen, was it's a rare medicine. I don't have it right now. I've ordered it. And aggravation: spirits after abuse of people can come with claustrophobic. They feel claustrophobia. They feel claustrophobic with the mask on, and mind fear, suffocation of, asthmatic complaints of. This is a very very common symptoms that we will see that, because people who are having breathing difficulties. I was asthmatic, and I to wear a mask, it's a problem for me sometimes. So, and these are not the atypical symptoms. This we are going to see it all the time. And asthmatic, arthritis and rheumatism flare up, washing hands frequently. People are wetting up their hands, it's all the damn things. So we can sort our medicines according to do. I know some people will say it's favorite medicine, or we have to take the whole case, but sometimes in the acute cases you have to, you know um, so these are just the examples of scenarios that we should dig into and be prepared, as we will be seeing plenty of cases with similar troubles. This whole pandemic thing is just not going to disappear like a, it's not going to disappear. It's here to stay. It's kind of a lifestyle change that we have to adopt to it. And then we can tell the patients that this is what we have to offer. So uh, and now, coming on to very important aspect of this whole pandemic scenario, social media, Google doctors. I'm sure you would agree with me that you guys are also seeing patients with too much of information. They're coming, taking all the information from social media, and they're binging on the supplements and herbal decoctions and all the herbal remedies. There's nothing wrong in that, but we have to equip ourselves with that knowledge of those supplements and herbs, their sphere of actions and adverse effects too. If some patient is coming to you saying that I'm having itching all over the body, mere taking aggravation and amelioration is not going to work. In some of the cases, we have to know that, oh, he has been taking some kind of herbal decoctions, uh, you know and most of the time those herbal decoctions, if taken, they lead to some sort of liver cleanse, and in absence of ample amount of water intake and enough minerals, it can lead to toxins being circulated in the body and leading to itching. So we have to know what is there to be treated. So we have to take a holistic approach. Here I'm sure all of you would say that homeopathy is holistic, but I'm talking about the approach which goes beyond homeopathic medicines as well. That's why I like to call it deeply holistic. I'm fortunate enough to have gained experience in those fields, and I urge all my fellow homeopaths to explore those less traversed methods as well, about which Henneman have also talked about, or rather, I should say, just gave some hints about in the later aphorisms in Organon. We have to strive and become experts in homeopathic medicines and holistic approach, no doubt, but we also have to brace ourselves with the latest techniques and procedures and knowledge which can actually make us healers by restoring mind, body, and spirit balance, and thus leading to permanent restoration of the health. So, in addition to taking symptoms, we have to be aware of the side effects of the supplements, herbal decoctions. What are their values? What can they cause? What we have to stop them from taking? What are we going to advise? um, so we have to actually know, as Eneman also said, that every physician has to know what is treatable in the disease. For example, detox rash, the main organs that are capable of flushing out unwanted toxins and chemicals from the body are liver, kidney, GI system, and the skin. Your skin plays an active role in the elimination process. through your pores. And since we sweat through our pores, a common skin reaction that is described by certain detox regimes, which many, trust me, many people at least here are taking. Oh, we are doing detox, and in India too, so many people are going on to herbal things to do whatnot to. Some people have issues to lose weight, or and so many other things. And even for this COVID preventions, an elimination diet, it's the main symptom is red, bumpy, itchy skin rash. So we have to acquire that knowledge so that when we can be one stop shop of healing for the suffering patients, the patient don't have to, I'll give you one example here. I have one patient who came with mouth ulcers, and on inquiring, I came to know that he has been gargling with rum. And as someone said on internet that it can save you from viral infections, he had ulcers in his mouth. I just gave him calendula drops to gargle and peel, and he was better in few days, and gave him knowledge, that these are not the things, you have to do these things. People are stressed at this point of time, and they will do whatever anyone will tell them to do, even including our family members. But as physicians, it is our duty to not only select appropriate remedies, but also guide them with providing the right informations. you know so we have to have those information, the information about the supplements. So I will talk about four main supplements here today: vitamin C, and vitamin D, zinc, and green tea. So let's talk about vitamin C. All right. So if vitamin C, for recommended daily amount of for vitamin C is 65 to 90 milligrams a day, and the upper limit is 2000 milligram a day. Although too much dietary vitamin C is unlikely to be harmful, but mega doses of vitamin C supplements might cause diarrhea, nausea, vomiting, heartburn, abdominal cramps, headache, insomnia. There was a trial in physically active young men who were only physically active, doing gym and whatnot. Supplements of vitamin C 1 gram per day resulted in increased post-exertional delayed muscular soreness to placebo. So if a patient comes to your clinic saying that, oh, I have been exercising a lot from many years, but I don't know why I am so sore these days. So your case taking process has to be focusing on what supplements he's taking. So maybe this supplement has caused this delayed into this post-exertional delayed muscular soreness. So we have to take all these points into consideration, and these things we have to get this knowledge, so to get to the exact symptoms. One more thing: most of the supplements, the chewable supplements, contain artificial sweeteners, a sorbitol or a xylitol. They can cause or aggravate diarrhea, especially at high doses. Some people might not be, doing well with that. So we have to be thorough in asking them what kind of supplements are they taking. And caution, in pregnancy, high doses of vitamin C have been associated with more low birth babies. And here in Canada, most of the people, I mean, I would not say most, at least majority of the people are taking over the counter aspirin and non-steroidal NSAIDs, non-steroidal anti-inflammatory drugs. So the high doses of vitamin C, if you're taking along with those medicines, they make these drugs to stay in the body, raising the levels in your blood. So we have to be careful with that. So, and the most common antipyretic that is used here is acetaminophen, Tylenol. So high doses of vitamin C may lower the amount of acetaminophen passed in urine, which could cause the level of these drugs in your blood to rise. So here people follow this rule that, take acetaminophen, Tylenol every 4 hours. But if they're taking high doses of vitamin C, we got to caution them that, you know what, you have to be careful now, because it is already the drug is not passing in your urine, and it is building up in the body. So you don't want to repeat it that often as you were doing it earlier. And similar cases is seen in even the aluminum containing antacids. vitamin C can increase the amount of aluminum your body absorbs, which could cause the side effect of these medicines to be worse. Aluminum containing antacids include Malax or Gaviscon. So, if the patient is taking any of those medicines and also binging on vitamin supplements, you can make him aware of this and switch him to dietary sources of vitamin C. If you know that, and most of the time we just stick to vitamin C as okay, citrus food, lemon juice, but whereas there are tons of other sources. If I have to tell the list, it can go on, like, vegetables are the highest sources of vitamin C, and some of the examples are broccoli, Brussels sprouts, and cauliflower, green and red peppers, spinach, cabbage, turnip greens, other leafy greens, sweet and white potatoes for that matter, tomatoes and white tomato juice, winter squash. If we come to fruit, cantaloupe, papaya, kiwi fruit, mango, pineapples, all the berries, strawberries, raspberry, blueberries, cranberries, watermelon, they are all indeed very good sources of vitamin C. So we can always tell people to start taking those things in their diet, include in their diet, and maybe they are saved from some of the side effects of the supplements. So coming on to vitamin D, it's known as sunshine vitamin, and actually it is very important because evidence from several clinical trials and pooled studies show that vitamin D supplementation lowers the odds of developing uh, acute respiratory tract infections, most of which are assumed to be due to viruses, by 12 to 75%. These studies include both the seasonal and pandemic flu caused by H1N1 viruses in 2009. The beneficial effect of supplementation was seen in patients across all ages and individuals with pre existing chronic illnesses. Among those who were infected, flu symptoms were fewer, and recovery was earlier if they had received doses of vitamin D greater than 1000 IU. The Vitamin D Council, a non-profit organization based in California that works to educate the public about vitamin D, notes that there are several factors that affect how much vitamin D your body produces when your skin is exposed to sunlight. These these factors include time of the year, time of the day of exposure, where you live, type of skin you are having, and even your age. Your skin's ability to produce vitamin D drops with your age. If you're above 65, you will generate only one fourth of much vitamin D as you did in your 20s. So you know that your patient is coming uh, above age 65. You have to consider those things. Are you taking your vitamin Ds? Have you got it checked? So, and even your weight. If you have a body mass index above 30, you may have low blood levels of vitamin D. Vitamin D is stored in fat. So, in people with obesity, less of vitamin circulates in the blood where it is available for use by the body. And the food you're eating, are you eating a fortified vitamin D fortified food? And certain health conditions as well affect the vitamin D levels in your body. People with conditions such as inflammatory bowel disease, liver disease, or cystic fibrosis, among others, may have trouble absorbing vitamin D, which can lead to deficiencies. So, according to IOM, the current recommended dietary intake of 600 to 800 IU for adults under the age of 70 and 800 to 1000 IU for adults over 70 is sufficient to meet the needs of almost 98% of healthy adults who have minimal sun exposure. Liquid drops are better, my opinion. Now let's talk about excess. So, vitamin D toxicity, it's known as hypervitaminosis D. It can cause the harm. So, um, I will really elaborate a little bit here quickly, not taking too much of time here. Vitamin D is a fat soluble vitamin. In contrast to water soluble vitamins, the body has no easy way of getting rid of fat soluble vitamins. For this reason, excessive amounts may build up inside the body. The exact mechanism behind vitamin D toxicity is complicated and isn't fully understood at this point. However, we know that the active form of vitamin D functions in a similar way as a steroid hormone. It travels inside the cells, telling them to turn genes on or off. Usually, most of the body's vitamin D is in storage, bound to either vitamin D receptors or carrier proteins. Very little free vitamin D is available. However, when vitamin D intake is extreme, the levels can become so high that there isn't any room left on the receptors or carrier proteins. This may lead to elevated levels of free vitamin D in the body, which may travel inside cells and overwhelm the signaling processes affected by vitamin D. And one of the main signaling processes has to do with increasing the absorption of calcium from digestive system. As a result, the main symptom of vitamin D toxicity is hypercalcemia, elevated levels of calcium in the body. I actually saw the one patient with hypercalcemia, and on inquiring, she was taking she was taking those recommended not take she was not taking those recommended drops. She was told to take about one drop every day, and she was pouring about 10 drops every day on the tongue, ended up in having hypercalcemia. So high calcium level can cause various symptoms, and then calcium can also bind to other tissue and damage them. These include the kidneys. So children age 9 year and older, adults and pregnant and breastfeeding women who take more than 4,000 IU a day of vitamin D might experience nausea, vomiting, poor appetite, constipation, weakness, weight loss, disorientation, heart rhythm problems, and heart problems and kidney damages. So if you talk about sources, the fatty fish like salmon, tuna, mackerel fish, and mushrooms, they are good food sources. All right, and now let's talk about the next thing that people are really taking are into it is zinc. So the current daily value of zinc is 11 milligram, and the tolerable upper intake levels for zinc of people who are not receiving zinc under medical supervision, because many doctors already give zinc supplements. So we have to see the patient is taking what medication are they taking. In adults 19 and older year is 40 milligram per day. And one more thing that has to be taken in account, if you are taking zinc supplement, or make sure that for 2 hours, ask the patients not to take bran or fiber containing foods, phosphorus containing food, just such as milk or poultry, whole grain breads and cereals, because it interferes with the absorption. And high zinc fruits include avocados, blackberries, pomegranates, raspberries, guavas, cantaloupes, peaches, kiwi fruits, blueberries. Berries are very good and they're very rich. Food high in zinc include oysters, beef, chicken, tofu, pork, and nuts, seeds, lentils, yogurt, oatmeal, mushrooms. Nuts and seeds are very high in zinc, and they include squash seeds, pumpkin seeds, pine nuts, cashews, sunflower seeds, pecans, chia seeds, flaxseed, ulsi, brazil nuts, and almonds. So we can ask the patients to increase those uptake of the seeds once in a while in a day, make it a portion, and they can take it. And since I told earlier in my presentation that there are many restrictions that we have to think, we cannot ask a patient to stop their medicine right away. It is their discretion. We cannot even suggest that they stop their medicine. So we have to be very sure that we have to ask that if a patient is on water pill, amiloride, it is a potassium sparing diuretic that increases level of zinc in your body. So that is a complete no-no with this for the zinc supplement. So you should see that they're not taking zinc supplements with amiloride. And high zinc intake can also lead to copper absorption. It can impede copper absorption, and it can lead to deficiencies, and it can lead to anemia, bone marrow failure, and neurological problems as well. So we have to exercise caution in using those. And then now coming on to the last supplement which I'm going to talk about is green tea. It's a green tea culture here, and it's indeed very important, very good thing to do. It is rich in polyphenols, catechins, and flavonoids, which show antioxidants, antimicrobial, alkalizing, and immune substimulating quantities. And in addition, the catechins in green tea may inhibit the growth of bacteria and some viruses, such as influenza virus, as well as lower the risk of infection. So, indeed, it is a good thing. And since the late 1990s, several epidemiological studies have suggested that the regular consumption of green tea decreases influenza infection rates and some cold symptoms, and that gargling with tea catkins may protect against the development of influenza infection. So, but as with anything else, it has some things it has to be which has to be taken in account, as it contains, though it contains small amount of caffeine, but it may still cause problem sleeping for people sensitive to caffeine. um, this is due to the fact that chemical compounds in green tea prevent the release of hormones such as melatonin, which aid in sleep. So there is another thing also in green tea. It's L-theanine, a chemical that induces calm, but it also increases alertness and focus, something that may disrupt sleep for some individuals. So now, while people may benefit from a cup of green tea before bed, people with caffeine sensitivity should consume it no later than 5 hours before bed. So again, we have to take this in consideration once we are talking to our patient. That when they are doing it, when they are not, there's no point giving them passiflora or any other, or Kelly Foss or whatever, if they're taking caffeine or green tea for that matter in the before bedtime, and they're bound to have insomnia. So, and another concern for tea lovers will be iron. Tannins and caffeine found in green tea can reduce iron absorption, especially plant-based iron. So if you're taking an iron supplement, make sure to wait at least 2 hours before sipping on your green tea. Iron deficient vegetarians and vegans should regulate their coffee and tea intake and monitor their iron stores regularly to ensure labs are improving. So, compounds in green tea also decrease levels of fibrinogen, a protein that helps clot blood, and it prevents oxidation of fatty acids, which can lead to thinner blood consistency. So, if you're suffering from blood clotting disorder, avoid drinking green tea. Um, while 3 to 6 cup is manageable, but don't get carried away. And I think that should be all. And let's all strive hard to take this epidemic and homeopathy and serve the, we should strive hard to tackle this epidemic with homeopathy and serve the serving humanity. Uh, we have an edge over other pathies with our homeopathic methods, and this is the time where we tell our world that we are here to stay, and go from there. And with this, I will conclude my today's presentation. And I thank Dr. Mukherjee, Dr. Kalyani sir, and Dr. Shishkant Tiwari sir, and all the NIH Alumni Association for inviting me and giving me a platform to share my information here. Hope this was helpful. And thank you so much, and have a good one.
She is having, Sir Kalani sir, Dr. Harpreet is having few questions from the audience. First question is from Shayan Chatterjee. Shayan Chatterjee. I'll request the backstage editor or could to highlight the question on the screen, please. The question
What is
for
this?
Harpreet.
Canada? Can I practice there? Passing my bachelor's degree. This question is from Sayan Chatterjee. Okay. Uh, I'll have to repeat my whole presentation again regarding the scope of homeopathy in Canada. And yes, you can. I have only done bachelor's in homeopathic medicine and surgery. Those 2 or 3 other degrees are just the additional perks that I'm enjoying. You can definitely come here, have passion, and start practicing. Regulations do vary from province to province. As Dr. Shashikant Tiwari sir was mentioning, I am also in Manitoba. I contacted Dr. Nelima Nelson as well when I came here, and she used to run that so-called institute, and it's not in presence anymore. They stopped that course long time back, and now there's only one college in Ontario, and they are having their different rules and regulations. If you have practiced long time, you can grandparent with submitting some things, but if you're in other provinces, there are some kind of limitations, but you can definitely practice. Is there any other question? I think that was the only thing, right? Yeah, I don't see any.
Yes, that was the only. Yeah, that was the only question from a student. Thank you, Harpreet and Prashin, for being with us, and all the juniors and seniors who have been watching. I'll request Dr. Kalyani to conclude the program tonight. The backstage editor, Orko, please bring on Kalyani, sir.
And thank you to the backstage editor for doing all this. He's genius. He was very much
I'll request Dr.
terrified
Kalyani,
in the
sir, to conclude
beginning that
today's session
he could not
with his
started.
inputs. I'd like to inform that Professor Shashikant Tiwari.
We are really, do you hear me?
Yes.
Yes.
We are really grateful to Dr. Tiwari for providing us time to be with us for a long period. We are really thankful. And to Prosen, beautiful presentation. I'm very happy.
Thank you, sir. Thank
Go
you.
on with a new light to help homeopathy. Beautiful. And for Harpreet, I can tell you what you are doing. I just remembering the life of animal. You are swimming against the flow of a river.
Thank you, sir.
Of a richest country by taking homeopathy in your heart and 2 kids in your hand.
Yes.
Really salute you.
Thank you, sir. That means a lot.
This sort of heart and hands and brain should be with us to strive with homeopathy if we really love homeopathy. Constraints, to overcome the constraints is power of mind, power of body. To practice in India is no matter because the field is ready. Field is ready. Anybody can practice anywhere. But we came to know that in Canada to practice homeopathy is very difficult, very hard. But please remember, the field of India was made by certain person, those has hearts and brain like you. They did not have any recognition, no degree, no position, no approval, not even doctors. They started practicing by learning from foreign countries. They started curing patients one by one for their sacrifice, devotion, and Hahnemann's Audi Sepera. Today, India has taken the shape of homeopathy. I think gradually, as Dr. Tiwari told, you go on service homeopathy. A day will come when you will get your proper recognition. Definitely.
Thank you so much.
Many thanks.
Thank you so much.
NIH is feeling proud of you, like students.
Thank you, sir. It means a lot to me.
We should learn from you this striving.
Yeah,
thanks. To fight against the obstacles. Anyway, thank you to all the viewers, listeners for joining with us, to encourage us, for sharing our ideas, thoughts, experiences by which all of us will grow together. to show what NIs can do in the world. Thank you very much. Thank you.
Thank you.
Thank you guys for watching the live stream. Due to some issues, I cannot show my face right now because some lighting issue. And thank you, Harpreet ma'am, Tusen sir, for cheering me up also. And thanks for coming to our show. So, and thank welcome, Harpreet ma'am. So the next, so we will be holding the next CME. It will be scheduled. Please, viewers, do make sure to subscribe and turn on the notification bell in order to check out or get notified with the next scheduled CME. And if you are liking our video, please, oh, my video is on. If you are liking our CME, then please do make sure to like this video also, and the other CMEs which we have done. You can get that on our channel. Just click on the channel and you will get over there. And the move banner I was just showing on the information. I hope everyone have seen it, and we will appreciate any donations from you all viewers. So again, thanks for watching. See you in our next live stream. And also we are on social media. The social media links are on description. Do make sure to follow us both on Facebook, Instagram, and Twitter. We give updates every time over there, and we are trying to do some extra social media accounts. We'll soon let you know in the description. So now, this is Orko Mukherjee, your backstage editor, signing off. Good night.